Okay, great. Thank you, and good afternoon, everybody. I hope everyone had a good weekend. Now, we're less than a week away from our July 4th holiday, a time when many of you will join with your family and your friends for backyard barbecues and fun. While my message is not to avoid fun, I'm standing here today to ask everyone to be safe and to do those things we have talked about since the beginning of March, to not just protect yourself, but also the community and your loved ones. To avoid a spike in COVID cases in our region, to avoid hospitalizations, and unfortunately to avoid some deaths as well, we all have to work together. Wearing face coverings in public, social distancing by at least 6 feet, and washing our hands will greatly reduce those odds. We've done a lot of great work over the past couple of months, and we don't want to undo it. Now let's get to today's data. I'll take some questions from the media at the end of our briefing. So here's the chart showing our hospital admissions, and it continues to show progress. Again, it shows the trend in daily hospital admissions since early April. Today we're reporting 16 new COVID admissions, which is up from 13 on Sunday. Our rolling average has stayed the same at 17 since we last spoke on Friday. Now remember, the blue line is what we're following, not so much those daily up and downs, but the trends. And remember, this data is an average of the past 7 days and has a 2-day time lag, and it only represents confirmed COVID positive patients, and that is why the data is lagged for a couple of days. Now, this next slide features our hospitalization numbers, and they continue to show progress as well. Now, as we mentioned on Friday, we're changing the way that we report this data. We'll now be showing you our confirmed COVID-19 admissions data, and this chart will not include our suspected COVID patients. The reason behind this is that most of those suspected COVID patients turned out to be negative for the virus, and so we felt like this would be a much more accurate representation of the data. As always, the rolling average is represented by the blue line, and it's been adjusted all the way back to the beginning of April, so all the numbers are true. Today's rolling average is 137, which is the same as it was yesterday. Today's overall hospital census did go up, and it's at 149, and we were at 127 yesterday. Again, we're not concerned with one-day jumps. It's not a trend, and we'll continue to follow the data and monitor the situation. Now for today's numbers. So let's bring you up to date on our daily hospitalization numbers. And remember, we're changing the way that we report this data so it's a little bit more accurate. So if we break down the hospitalization number and show you just those patients who are confirmed COVID positive, we have 149 patients. We'll do the same for our intensive care unit patients, and we have 35 patients in our ICUs, which is up from 31 yesterday. And we have 22 confirmed COVID patients on ventilators today, which is decreased from 23 yesterday. And again, this is a change for how we've been reporting the data to you. And we're going to show a separate slide showing our suspected COVID patients. So this slide here is our suspected COVID patients. It's the same there. These are the hospitalized patients. So we have 106 patients under investigation or suspected of having COVID in our hospitals today. 9 are in our intensive care units, and 3 are currently on ventilators. So again, a little bit different breakout in our numbers than we've previously shown. And of course, our good news slide, we had 14 patients that were discharged yesterday, bringing our cumulative total to 2,868. And again, we'll thank our healthcare workers for taking such good care of all of these patients, getting them better so that they can get home to enjoy this holiday weekend. So in conclusion, as you just saw, our curve continues to flatten, and we've been performing well here in the St. Louis area. But this is because all of us have continued to do our part in staying socially distant, wearing masks when we can't, and washing our hands. And we're all responsible for keeping each other safe. As I had said before, we're all in this together. Now, before I take questions from the media, I will wrap up in a similar way with how I started. We understand that this has been a really long couple of months, but it's not over. The virus is still out there, and it is still dangerous. We've learned a lot of valuable lessons and have done a lot of hard work to get to where we are today. So as you gather with your friends and family this holiday weekend, please remember to be safe and help us avoid seeing an increase in cases and hospitalizations. We know that by taking these actions, we can save lives, so that as you celebrate Independence Day, we ask that you remember to do those things to protect yourself, those around you, and those that you love, so that we may all enjoy life, liberty, and the pursuit of happiness. I'll be back with our live briefings on Wednesday and Friday of this week, so please join us for that. And now we'd be happy to address some of the questions that we have received from the news media.
Our first question is about the hospitals reopening to visitors. How do hospitals calculate the decision to reopen if cases are still going up and the disease is still circulating?
That's a good question, and there was a lot of debate about visitor policy amongst all of the hospitals. So with our declining hospitalization rates, we felt we were at a stable place. We had enough protections in place, and then allowing a limited number of visitors to come, we felt that we were relatively safe in taking that next step. Now, of course, that's with a lot of different restrictions. So people will have to wear masks while in the facility. There'll only be one visitor per patient. A lot of other things. So it won't be the visitor policy that you were used to pre-COVID. In addition, we have a number of other things that we'll be looking at so that if we do see an uptick in cases or see some other data, then we can ratchet that back down. But one of the other reasons is we do also recognize the healing power that visitors bring to people in the hospital as well. And so it's important that we're able to balance all of these different things while we're implementing this policy.
We are hearing more calls from members of Congress, governors, and state and local leaders around the country for the president to issue an executive order directing everyone to wear a face mask. Would you support such a mandatory order, and why?
So it's important to recognize that face masks do help prevent transmission. There's plenty of evidence that supports being able to decrease transmission in the community with the wearing of face masks. There have been different communities around the country that have implemented mandatory face mask rules, and I would say I would leave it up to those individual jurisdictions to decide when it's most appropriate for them to institute those types of rules. If we look at it from a public health perspective, anything that we can do to decrease mitigation or increase mitigation of spreading virus are good things, such as wearing masks, socially distancing, limiting the numbers in crowds, things like that. And so in that vein, I do support people wearing masks. We also know that in looking at other countries that have worn face masks or have a much higher percentage of people that wear face masks, their case rates are much lower than those that don't. And so what that all adds up to is it is an important policy decision to implement mask wearing. There are other factors to take into account, but by and large, it is an important public health measure that should be seriously considered.
Did the rising number of cases in Missouri give you any cause for concern that the St. Louis area could be headed for a similar fate?
It does. The rising cases throughout the state are always worrisome. We've been fairly fortunate here in St. Louis that the actions that were taken early on were able to suppress the curve, and that we have been doing the right things with opening the economy slowly and pushing those protective measures, such as the face masks and social distancing and limiting crowd sizes. But anytime that you have an increase in the number of cases in the surrounding community within the state, that always increases the probability that you're going to see more cases within the metropolitan area as well. So it does concern us, and we'll be keeping an eye on the data, on the case data, the hospitalization data, to make sure that we're seeing any upticks in case counts.
Do you believe the virus has mutated and may be becoming easier to spread as laboratory experiments may have suggested?
So there have been a couple of different variants of the SARS-CoV-2, which is the virus that causes COVID. The mutation that is coming out of it was the most predominant one in New York City, seems to be dominating more so now than the one that originated out of China. And the reason for that was a change in the protein spikes on the cover of the virus, which potentially makes it more infectious. It's only been shown in cell culture for now, so we're not positive that that's what the cause is. But certainly could increase, if you follow this logically, then could increase transmission and make it easier to spread. There hasn't been any data to show that it makes people more sick, but if it makes it easier to spread, that would increase transmission throughout the community.
That concludes today's briefing with Dr. Alex Garza and the St. Louis Pandemic Task Force. Thank you for joining us.